Namaste. Very good evening. Um, I am, you know, today I know it is a bit late. We are, I have, I'm starting the live a bit late. So I am your emotional healing synergist. This is Dr. Aparna, and I am an Ayurvedic psychotherapist, a passionate infopreneur, medical writer, and a budding YouTuber. Today is a continuation series of our my me addressing on autism. I have addressed on autism and signs and symptoms of autism, risks of autism, incidents of autism, and types of autism and management in brief in the previous three sessions. All the three sessions are available on LinkedIn and YouTube. So today's topic of discussion actually is on ABA therapy. But before starting that and discussing about autism management, I want to tell a few things. See, don't consider autism as an abnormality. It is just a neurodiversity or a neurovariance. So if you ask me what is neurodiversity, neurodiversity is the idea that neurological there is biodiversity. All individuals are not biologically the same. Individuals. So what it advocates is it advocates inclusivity, acceptance, and support for the people with neurodivergent conditions. Let's be inclusive and accept them as one among us and support them however possible for us. See, rather than, pathologizing, like means telling it as, looking it as abnormal and stereotyping a neurodivergent condition, we have to make it inclusive. We have to, accept it as a diversity rather than bullying the children with autism or ADHD or dyslexia or with any other neurodevelopmental defects. This is our responsibility as citizens and my responsibility as a doctor and professional to let you know that while I'm addressing autism. So we have to accommodate and support them. And basically, we have to emphasize on the strengths. I had discussed earlier as well in the previous sessions. You can go refer the first three sessions and then refer to this session because you can understand it in detail. So we have to emphasize on the strengths. See, recognizing and utilizing the strengths and abilities. The neurodivergent conditions gives in brings in strengths as well. Autistic children have their own strengths as well as they have deficits. So rather than solely focusing on challenges and deficits, we also have to focus on their strengths. Next is we have to the new what this does is we have to get into the neurodiversity paradigm. What happens is this encourages self advocacy and empowerment for individuals with neurodivergent conditions. So, giving them a voice in decisions that affect their lives. So, we have to dismantle all the stigmas and stereotypes. You know, this is, while challenging negative stereotypes and stigmas associated with neurodivergent conditions, we often see children with neurodevelopmental disorders are treated poorly, bullied, treated as abnormal individuals. So we have to be more inclusive and accepting as society, and for the parents as well. So if you be more inclusive, accepting, engaging, and supporting your child, then the child will be able to normalize to the environment. So this is a part of the education and awareness series, on this is just a neuro variation. Autism or any other neurodevelopmental disorder for that matter is a neuro variation. Yes, we call it a disorder in a psychological aspect. That is for a reason, not to treat those children or individuals as abnormal people. Yes, after this, um after a you can say a request or a rant as a professional, um after this I'm going to start what is ABA in autism. See, ABA is the approved technique, most approved technique. There are so many therapies that I had discussed briefly in the previous in which I had addressed autism previously. So here we are exclusively talking about ABA. So what is ABA? So ABA is applied behavior analysis. So this ABA is a widely used and evidence based intervention for individuals with autism spectrum disorder. So it focuses on understanding and modifying behavior in order to, what is the main goal here, to improve social communication and adaptive skills, to make the child more independent and the child get into the normal school and normalize as normalize as much as possible. So ABA here is a therapeutic approach. It is called ABA therapy. So what it does is it is based on the principles of behavioralism and focuses on understanding and changing behavior through observation and reinforcement techniques. So how, what is it? So the objective is ABA, as the name itself suggests, applied behavior analysis. So ABA relies on precise measurement. So this can be measured and you know you analyze the behavior, analysis of the behavior. So this means that the behaviors are defined in observable and measurable terms. For example, instead of saying a child is aggressive, ABA would specify the behaviors that fall under aggression. That means what is the specific behavior? What is the aggressive behavior? Either the child is hitting, either the child is beating, either the child is screaming, either the child is harming self or harming others. The thing is, here it is measured in ABA. Everything is measured. Instead of saying just aggressive, what is the what type of aggression, what is the behavior here? Because when we measure things, we can change them as well, so we'll know it later. So what ABA has various techniques to shape and modify behavior. So these techniques include positive reinforcement, prompting, shaping, and fading. I'll talk about all the techniques in detail. So this technique ABA is actually a data driven approach. That means data is collected to track progress and inform decision making. So all the data is collected and it is analyzed, it is very much analyzed. This helps in evaluating the effectiveness of interventions and making necessary adjustments. So if there is any intervention required in between the therapy, and if we have to adjust something, so this helps, because everything is documented and we track everything here. And here ABA is a individualized treatment plan. It is a customizable plan for each and every child or individual. So ABA programs are tailored to each individual unique needs, strengths and challenges, because the challenges, the strengths, and the needs of the child differ. So, interventions are designed based on a thorough assessment. First, a thorough assessment is made of the skills and behaviors, of the challenges. So, what behaviors need to be modified? Next is the functional assessment part. So here ABA seeks to understand the function or the purpose of a behavior. So why is the child behaving, how it is behaving? The behavior always has a purpose. Either the child needs attention, either the child needs access to something, or likewise. So it looks at what is triggering a behavior and what the person gains from engaging in that behavior. The behavior is has always a gain. A child behaves in a certain way because it has worked for the child in the past. For example, shouting or screaming to get something and the parents giving it has worked for the child, so child has observed that, it has inculcated that, and the next time it does the same. So what are we doing here is, we are reinforcing a positive behavior, that to ask instead of screaming, shouting, hitting. We um, train the child to ask for something nicely in a polite way. So here there are some basic things which are called ABCs of ABA. So what is the ABC? So for every behavior there is an antecedent. That means a previous thing which happens, the need which arises. That means this refers to the events or conditions or stimuli that occur before the behavior. So it sets the stage for the behavior to occur. So here antecedents can be physical, social, or internal thoughts. That means for a child to behave in a certain way, as I said, there is a reason. Next is A. This is the A is antecedent. Next comes the behavior. So what is behavior here is this is the observable and measurable action or response exhibited by the child or the individual. It is what the person does in a given situation. There is a given situation which is called antecedent, for which a child is responding or an individual is responding by screaming, shouting, crying, you know, and then the consequence. So, this is what happens immediately after the behavior. That means sometimes the parents or the caregivers give in to the behavior. So that is what happens, and that is what works, and that is what the child learns, that this behavior is working for me. Crying or shouting or screaming is working for me. So consequences can either reinforce, that means increase the likelihood of the behavior happening again and again, or punish. Punish here is not negatively punish a child, just punish is the positive way of punishment. That means taking away a bit of playtime or whatever it likes, that just to bring the child back to a positive behavior. That means to decrease the likelihood of the behavior, to decrease the negative behavior, and to positively reinforce another behavior. So for example, here there is a tantrum behavior. That means the child is asked to turn off the TV to come to have dinner. Suppose it is a 5 or 6 year old child. So when the this is the antecedent. What is the antecedent? Is the mother or the father, the parent, ask the child to turn off the TV and come to dinner. Next is the behavior B. So the child starts crying, yelling, and refuses to turn off the TV. So next is the consequence. What is the consequence in the normal scenario? If the parent gives in and allows the child to continue watching TV, so what happens? It is a win for the child there. So this could reinforce the tantrum behavior. What will happen is next time, if the parent gives in to that behavior and allows the child to continue watching TV, then what happens? This child will repeat the same again in future, the next day as well, because the crying, yelling, and refusing is working for the child. So this normally happens. This behavior is changed in the ABA therapy. So I'll talk about it while we talk. Next example. What is ABC, of ABA? So completing homework. What is the here is the antecedent. That means the parent sets up a quiet workspace for the child with all necessary materials to do its homework. Suppose it is a 7 or 8 year old child, and the parent sets up a quiet workspace because they know the child is autistic, for the child with all necessary materials for the child to do their homework, his or her homework. The child sits down and starts working on their homework. This is the behavior. This is what is this? This is a good behavior. So we are telling that if a child performs a good behavior, suppose the child sits down and starts working on their homework, then what the parent should do is the parent should provide positive feedback or a small reward for the child. Why? For the good behavior. When the child completes their homework, what happens is this reinforces the behavior. Oh, I did my homework and I got a small reward or a great feedback from my parents. This is the thing. This is when the child behaves positively. Suppose if the child, here also starts yelling, screaming, and doesn't want to do the homework, then it should be dealt with a different way. So dealing with things, how to dealing with behaviors. So these are some of the examples. So what it does is, the goal or the objective of ABA is applied behavior analysis is to promote positive behaviors and to reduce challenging ones by systematically analyzing and modifying the environment and the consequences of the behavior. It is a collaborative process. It involves therapists, parents, caregivers working together, the school, etc. Everybody working together to support the child's development and well being. So, it is a collaborative process. So, the primary goal is to improve socially significant behaviors. That means if a child has to improve the behaviors which are important for daily life and reduce the problematic ones. So um how does the ABA begin? So what the therapists do is, first they assess for behavioral assessments. So ABA begins with a thorough assessment to identify specific behaviors, their functions, and environmental factors affecting them. So, this involves direct observation, interviewing the parents, interviewing the child, maybe, and data collection. So, this is first what is done is assessment, behavioral assessment. Next is targeted goals. So, based on the assessment, specific, measurable, and achievable goals are set. So, specific goals. What is the behavior that needs to be changed, to how it should be changed, and achievable goals. So, how to do it? These goals are tailored or customized to the child's unique needs, considering their age, abilities, and challenges. You should also consider the child's age, abilities, and challenges. Last time I already in the previous session itself I had already said, suppose if the child is 8 years old and its neurodevelopment is of 3 years old, we cannot overwhelm the child at once. To be an 8-year-old, we have to take it slowly. And also, we cannot treat the 8-year-old child as a 3-year-old child. So, it has to be a balance. So, there has to be a balance in doing that. So, this is what we learn in ABA. And behavioral interventions. So, ABA uses evidence based strategies to address behavior. So, this includes positive reinforcement. So, what is positive reinforcement? Is encouraging desired behaviors by providing, rewards or positive consequences. So, if a child, as I said, sits for his or her homework and completes the homework, you have either you praise the child and reward the child, or for example, praising a child for sharing a toy. What happens is, in autism, the child prefers to always be isolated. The child doesn't want to play with, he or she doesn't want to play with the peers of friends. So if the child shares a toy, then praising the child, and at least clapping for the child or appreciating the child for that, so that next time the child does the same, it shares with another child, it plays with another child. This is positive in reinforcement. So as there is positive reinforcement, there is negative reinforcement. So what is negative reinforcement? Is removing aversive stimuli when a desired behavior occurs. So if a child completes their homework, they can avoid a household chore or a responsibility. This is for a 12 or 13-year old. If the 12 or 13-year old, for example, has to clean that he has to clean his wardrobe once a month or something like that. If that child completes his homework, or is behaving, one of the behavior is good, then what you do is, one time, for once, you cancel that cleaning of the wardrobe. This is negative reinforcement, that is taking away a chore or a responsibility. Why you're doing that? For that thing, for you to take away that one thing, the child will do repeat it, again and again. This is called negative reinforcement. These every enforcement is not done for every child, according to the needs, according to the challenges, according to the age. As I said, it is done. And prompting and prompt fading, this is also a technique, like providing assistance or cues to help individual perform a behavior, and gradually reducing this assistance over time. If a child, imagine it has to do complete a work, you prompting and assisting the child in doing, in completing work, so that it becomes easier for the child. But gradually, once the child is able to do it, then prompt fading is advised. That means reducing the assistance. Whatever you assistance you provide, that assistance should be gradually reduced, so that child does the work independently. Next is extinction. Extinction is withholding reinforcement for undesirable behaviors to reduce their occurrence. I'll talk about it um, in the coming thing, in the session itself. So next is, extinction, we'll talk about it. Functional communication training. So what is functional communication training? Is this is also one method or one strategy in ABA. So teaching alternative ways to express needs and wants. you know if a child is hungry and the child is screaming, crying, or yelling, or throwing things at mother or father for the food when it is hungry, to functional communication training is to teach the child to say that normally, people, you might feel, people who are listening might feel, array, this is normal, that if the child is hungry, it asks for food. But in autism, it is not normal. Here, the child will not ask for food. It may scream, it may yell, it may throw things, it may start crying. So to reinforce, communicate, like to train the child, teaching the child alternative ways. How can he or she ask for food? politely, or how, or by non-verbal cues as well. How can they ask for food? By signals. If the child is very small and there is speech delay or something like that, so how can they ask for food? With signs and signals, with non-verbal cues. That is what is taught. Next what we do is, these are the some of the strategies I will explain in detail. So next is in the data analysis, collection and analysis. So ABA relies on data to track progress. So what we do is, for every behavior the progress is tracked. So this involves regular systematic recording of behavior and analyzing trends over time, over a month, over a week, over a month. What changes are seen in a child after the ABA therapy? Everything is tracked. If it is not working, suppose if some method or some technique or some strategy is not working, you can change the strategy, you can fix it, so according to the need and the challenge. you know Generalization is here. It's crucial that the learned behaviors generalize across different settings, people and situations. For example, for instance, you know if a child learns to greet a therapist, if it is taught in the therapy that the child, when it comes, it has to greet the therapist. So they should also do this with family and peers. So this should be generalized, not only treating, greeting a therapist. They should generalize this to their teachers, their relatives, their parents, their peers, their caregivers. So this should be generalized. The good behaviors, or the taught behaviors, or the learned behaviors should be generalized. Next is the maintenance, ensuring that the learned behaviors persist over time, and the child should not forget the behavior after, in the therapy they learn something and they go home, or in some days they unlearn that. Unlearning should not happen here. So the maintenance of the behavior is very much important. Ensuring that the learned behaviors persist over time is another key principle. This is achieved through continued practice and reinforcement, making the child do it again and again and again, repeating it, making the child repeat the behaviors again and again and again. Next is individualization. So, here ABA programs are highly individualized. That means what works for one person may not work for another. This is not one size fits all. The approach is customizable, as I said. So, strategies are tailored to the unique strengths and challenges of each individuals. Next is ethical consideration. This is the most important thing, because previously ABA was practiced in a very rude way, like electrical shocks were also given. So ABA was a controversy and the punishments given were a bit harsh. So ABA practitioners must adhere to ethical guidelines, treating the child as a human. And every child has the same, you should have the same rights as a human, whether it is an autistic child, whether it is with ADHD. The children should be treated with same courtesy, same empathy, love. And ethically the guideline should be considered, because while enforcing it should not be harsh, rude, and it should not take a toll on the child negatively. We are doing it for the child to become independent, and you have more socially significant behaviors, but it should not go, inversely, to the child should not become depressed after, getting the ABA therapy. It should not be a nightmare to the child. It should be fun, enjoyable, learnable experience. So that is the reason ABA practitioners must adhere to ethical guidelines, ensuring that the interventions are respectful, beneficial, and considered for the well being of the individual. See, as far as the duration of ABA therapy goes, it varies depending on the individual's needs. Some individuals may benefit from intensive full time programs, while others may require fewer hours per week. It depends on children. Some children will require intensive, full time programs. Others may require few hours per week. So continuous assessment is crucial to determine, the progress and make adjustments as needed. So assessment in ABA involves ongoing data collection, behavior tracking, and regular meetings with the therapist to review progress. And it is not that after they learn something in the therapy and they unlearn at home. Parents must be constantly, engaging with the child. Parents or the caregivers must be, consistently support them and constantly engage with them, with the children. So, and then the therapist may use standardized assessments and conduct functional behavior assessments to gain insights into the effectiveness of the interventions and make any necessary modifications to the treatment plan. First, a treatment plan is made, and they work on the treatment plan. If there are any adjustments need to be made, or it there needs to be a shift in the plan, modifications can be made in the treatment plan. It is not that they make a treatment plan and it works completely 100% accordingly. No, there may be so many modifications need to be made, because we are dealing with a human, you know um that's why we are not dealing with a thing, and all humans are not the same, diverse. So there need to be made some modifications need to be made at times. Next here is about this approach. This is empirical approach. Empirical is, the assessment is made, and according to the assessment, the therapy is started. So, ABA relies on systematic observation and measurement of behavior. It uses data collection to assess progress and make informed decisions about interventions. That means a therapist uses a data sheet to track a child's responses during a communication exercise to monitor progress over time. Here, as I said, and ABA may also be sometimes accompanied with speech therapy, occupational therapy, all these therapies, because if there is a delay in speech and language development, then a speech therapy will be required. Likewise, the occupational therapy. So, for example, a therapist uses a data sheet to track a child's responses during a communication exercise to monitor progress over time. So, as I said, the ABCs, once again, I'll repeat. So, the antecedent is event, circumstance, or stimuli before a behavior. So antecedents can influence the likelihood of a particular behavior that is occurring. So for example, antecedent is a child is given a complex maths problem to solve. And what is the behavior? The child becomes frustrated and refuses to attempt the problem. It may start throwing things, it may start screaming, yelling. Okay, this is one example. Next example for an antecedent: a group of children are playing with toys, and one child wants to join in. Then what happens? The child approaches the group and asks if they can play too. This here is a good behavior. This is just an example that antecedent and a behavior in general also, in normal children also, there is an antecedent and a behavior. So likewise, next, behavior is what is observable, measurable action or response which occurs in a specific context. That means, for example, a child is, in a crowded and noisy environment. I had, mentioned it previously as well. Children with autism cannot tolerate changes in their schedule. They are hypersensitive to noise, light, sound, etc. So, a child is in a crowded, noisy environment. So, what that is the antecedent. What is the behavior? The child covers their ears and becomes visibly distressed. We can see that the child is very much distressed because of the noise. At times, it may start crying. So, this is the behavior. So, next is consequence. This refers to what immediately, what happens immediately after a behavior. So, consequences can either reinforce or discourage the likelihood of the behavior occurring again. So, for example, antecedent is a child sibling takes their toy without asking. Suppose a child's sister or brother takes the child's his or her toy without asking. The child cries and tries to retrieve the toy. This is the behavior. The child wants its toy back. So it cries and tries to take the toy. The consequence here is the parent intervenes, reprimanding the sibling and returning the toy to the child. So what happens is the parent comes and takes the toy from the sibling and gives it to um, this autistic child. So what happens is that child learns that this thing is working, trying, crying and trying to retrieve the toy, yelling, screaming, everything is working in its favor. So what is this is it repeats the behavior again. So instead, what should have happened is parents should have taught sharing there. So that sharing part is missing. So that is taught in the ABA. The next example. So next is, we see, for example, see, in applied behavior in analysis, it has several, fundamental principles. I talked about positive reinforcement. We'll talk about everything in detail. So what is positive reinforcement here? As I said, this involves providing a reward or positive consequence after a desired behavior occurs, which increases the likelihood of that behavior happening again in the future. For example, if a child completes their homework, that is the desired behavior. So they receive extra playtime. That is the reward. You can give the child the extra playtime, at least for 15 minutes to a half an hour. What is it? You are rewarding the child, and this is a positive reinforcement. What happens is the child, it is fixed in the child's mind that if it does the homework, it will receive the extra playtime. This is how you reinforce. Again, what can be done is, once the homework, the homework or the chore is normalized, you can, minimize the playtime, and that you can the reward what you're giving, you can minimize that, because every time for every day you can't. But for positively reinforcing something, you have to give a reward. So that is positive reinforcement. And then, as I said, negative reinforcement. See, this involves removing or avoiding an aversive stimulus after a desired behavior, which also increases the likelihood of that behavior occurring, again. For example, if an autistic child puts on their seat belt, putting on the seat belt by itself is a desired behavior, then what you do is, you just cut off the annoying sound. Suppose if the child is annoyed by some beeping sounds, removal of the stimuli, removing of something which the child is annoyed of, or which the child doesn't want to do. The next time this is reinforced in the child, the next time what the child does is it wears the seat belt on its own. You are reinforcing the behavior. Next is the punishment. Here the punishment is not any harsh punishment, it must be very ethical, considering that means that involves an aversive consequence after an undesired behavior, which decreases the likelihood of that behavior happening again. That means if a child hits a sibling, this is an undesired behavior. Hitting is not a desired behavior. If the autistic child hits his or her sibling, then they might lose some playtime. You are putting the child into timeout, or they are losing some time, some playtime. You'll tell the child, if you hit your sibling again, then you will not be able to play whatever it is in whatever the child is interested in. So what happens, here is, and the punishment should not be, very harsh or rude. We are not talking about that. This is only taking away the playtime, or keeping the child in the time out for some time. It is just that. It is not a harsh or severe punishment, no. It is just to teach the child, or that the behavior is wrong, and whenever the behavior is wrong, there is a punishment. As there is a reward for the right behavior, there is a punishment for the wrong behavior. It's just that. Then is extinction. I said extinction, I'll explain in detail. So this involves withholding reinforcement for a previously reinforced behavior, leading to a decrease in that behavior over time. That means if a child used to get attention for tantrums, but caregivers consistently ignore tantrums, the tantrums may decrease over time due to lack of reinforcement. So, earlier, what used to happen is, when the child, if an autistic child, let's say, when a child gets attention, when it's, screams, shouts, cries, yells, either it needs access to something or attention for something. So suppose the child is getting, the parents are giving attention to the child whenever it screams, shouts. But here what happens is, over a period of time, parents or caregivers start, you know start ignoring their tantrums. So when the tantrum is ignored, when the child cries or yells or does the tantrum to get attention or access to something, if the tantrum is ignored, then what happens is the child realizes that it is not working. So over a period of time, extinction means this tantrums decreases over a period of time due to lack of reinforcement, because the child knows 2 or 3 times it tries, 2 or 3 days, showing tantrums for attention or access to something. When it knows that the tantrums are being ignored, the reinforcement is stopped. That is what is called extinction. Next is prompting. Prompting, as I said, this involves providing cues or assistance to help a person to perform a desired behavior. So, if a child is learning to tie their shoes, a parent might initially provide physical guidance in the process. Helping the child tying the shoelace initially, then, involving the child, then reducing the assistance. You do one shoe, let the child do another shoe, then tell the child to do it on their own. This should be gradual. That is called prompting and prompt fading. That means first you um, provide cues and assistance to help perform a desired behavior, and then you gradually slow it down when the child becomes independent of that task. Next is shaping. Shaping means this involves gradually reinforcing closer and closer approximations of a target behavior until the desired behavior is achieved. That means if a child is learning to write, they might first be reinforced for marking marks on the paper. First day only they can't start writing ABCs or whatever they are writing. So in initially they have to mark on the, they will only mark on the papers. Then for making letter like shapes, you have to take the process gradually. Then you start making, writing letters and tell them to repeat or fill inside, like we used to write the copywriting things, and eventually forming actual letters. So shaping is doing it in a procedure. Next is generalization. Generalization, I discussed this earlier. That means this involves the ability to perform a learned behavior in different settings with different people in different ways. So, if a child learns to greet their teacher in the classroom, they should also be able to generalize this skill to greeting a new teacher, a different teacher in a different environment. If they are doing it for their class teacher in the classroom, it has to also do with the music teacher or the dance teacher. it the child has to also greet to the music teacher, dance teacher. Next is maintenance. Maintenance is, this refers to the continued performance of a behavior over time, even after the intervention has been removed. That means if a child learns to independently brush their teeth through ABA, they should continue to do so without ongoing prompts or reinforcement. The behavior should be continued lifelong. The brushing or teeth or the doing homework independently, whatever the behavior is learned through ABA. Next is the behavior contrast. That means this refers to a change in behavior in one situation due to changes in the reinforcement or punishment in other situation. That means if a child receives a new reward system for completing homework, they might become less motivated to do their chores if their chores are no longer reinforced. So, what happens is it becomes a behavior for a child that, for every good thing the child does, there should be a reward. So this will not be the case always. That means if the child receives a new reward, new reward or appreciation or a praise for completing some homework, or doing a behavior right, so become less motivated to do their chores or other things if the chores are no longer reinforced. So everything should be reinforced and everything should be rewarded. It happens like that. So it has to have a contrast or a balance. This method is a bit complicated, and it is taught in the session if needed by a therapist. Next is behavioral momentum. The last thing is that means this strategy, involves high probability behaviors to increase the likelihood of engaging in lower probability behaviors. That means if a child is resisting a task, a therapist might first ask the child to complete a series of easy tasks they are likely to do, then building momentum for the more challenging task. That means before you go to a more challenging task, building it with a series of easy tasks that the child is doing. Then once the child develops that behavior and gets the momentum for it, builds the momentum for it, then giving a more challenging task. So these principles are applied in a systematic and individualized manner in ABA therapy to help individuals with autism acquire new skills, reduce challenging behaviors, and improve their overall quality of life. So this is, in brief, what is ABA. So this is in brief, what is ABA. So we'll discuss about it. If you have any queries and if you want to know more about it, so please let me know in the comment section. I will come up in some other session in future about once again about the ABA. So let's not treat autism as an abnormality. Let's treat as a neurovariance or a neurodiversity, and be more inclusive, adaptive, supportive, and appreciative of autistic children. So thank you for staying tuned, and I'll see you in the next session. Good night. Namaste.